Good afternoon. My name is Lance Evans, Superintendent of New Albany School District. I want to thank you for joining us again for our live stream. Today we've got Dr. H.F. Mason with us and Mayor Tim Kent. We're going to bring an update to you about some of the things that are taking place in our school district, in the medical world, as well as in our city. So I'll just start off by, again, I want to encourage all of our teachers and especially all of our students and our parents to be diligent in ensuring that your child is taking part in the virtual online classes. All of our teachers are taking attendance every day, and we're just monitoring to ensure that any student who doesn't have access to the internet, that we're getting them that information they need from instructional packets or whatever might be the case. Just another quick reminder, remember that we are providing internet services for you through our buses that we have parked around our school district. And those are open not just to our students, those are also open to people in the public. So please take advantage of those, and they're a very good resource for you. Tomorrow, the Governor Reeves, will address our state, and it's slated for him to talk about public schools and the reopening of public schools, and if or when that will happen. So if you would, please be sure and tune in. His press conference is typically being covered on the WTVA app, as well as on, I believe it's the FEMA Facebook page. So please just reach out and be sure and watch those. Based on his decision that he makes related back to K-12 schools, we'll have a live stream so that we can ensure that you are up to date on the happenings of the New Albany School District as well as public education in our state. Just know that no matter what decisions are made, we are committed to taking care of your child and the employees we have in our school district. Two other quick things. One is I want to thank our parents for all the hard work that they're putting in. I know that this is a tough time for parents. Our country is in a situation where we've never been before, and we really don't know what to do in some cases. We've got levels of unemployment that are unprecedented. It's a really tough time, and the main thing that we feel is vital to your child is to continue their social and emotional support as well as their education. That brings that sense of normalcy to your child and also to your home. So please make sure that your children are taking part in those. And remember, you're getting that information from your child's teacher at the beginning of each week. So it's very easy to follow along. And you can also communicate through school status, and those teachers are doing that with you as well. The last point is graduation. I'm sorry, I really still don't have any information for you there. Again, that'll be dependent on what the governor's decision is, but pretty much anything is on the table. Remember, we are committed to having that traditional graduation ceremony. When that takes place, I don't know. I can't answer that question. But we will make sure that our students are given the opportunity to graduate like they have earned the right to do. Next, we'll turn it over to Dr. H.F. Mason.
Oh, sorry. I was waiting on a question. I just want to say thank you for what all you guys are doing around town with your social distancing, and I think that we're really starting to see some fruits of our labor with the mitigation things that we're doing. Fortunately, we live in a small town. We live in a small state, and because of that, we haven't seen near as many cases in our town or in our county as other people have. And I just want to reiterate that right now we're dealing with a virus that number one, we don't know a whole lot about. Number two, we don't have a vaccine for. And number three, we don't really have any proven treatment for right now, and the only thing that we can do right now is to social distance ourselves, and we just need to keep hammering that home. And I know nobody likes being cooped up, but it is working and it's helping.
So one of the questions is, how bad is the hospital compared to what people are seeing on the news from New York City? Is our hospital experiencing the same thing they're experiencing?
No, you know, comparing us to New York City is like comparing apples to oranges. We haven't seen near as many cases here in New Albany. Our hospital's in good shape. I think we have tested maybe 150 patients so far here at our hospital. We have had maybe 10 positive, so that is nowhere near the kind of numbers that they're seeing up north. We're not seeing any of those numbers here in Mississippi. I think right now we have maybe around 3,000 cases in Mississippi and maybe just a little less than 100 deaths. And you know, you look at New York. New York has 8.5 million people crammed in a space of about 300 square miles. In Mississippi, we have about 3 million people spread out over 48,000 square miles. So we are sort of socially distancing ourselves as it is. And when you get that many people cooped up in that small of space, this disease can spread a lot easier.
So can you talk about, so one person's saying that this seems, a lot of people say it's like the flu. And is it actually more like pneumonia? And why is this so much worse than the flu?
Well, it's not exactly like the flu. First of all, it's a little more contagious than the flu. Normally, the flu may infect 1 to 1. This virus, I think, depending on what you read, it may infect people 3 to 4 to 1. That means one person will infect 3 to 4 others. It is a virus, and it's interesting because a lot of times is what it is. Like the flu, it's the superimposed pneumonia that people get. It attacks your lungs. It causes your lungs to get leaky, and your lungs fill up with fluid, and then you get a pneumonia on top of that. Now, it is interesting that some people have a much higher immune response to the virus, and that immune response causes the lungs to get real leaky and can make it a lot worse. I don't know if you, Senator Rand Paul, he had the coronavirus, and I just saw an interview with him. He had hardly any symptoms at all. And as a matter of fact, he said, I wouldn't even have gone to the doctor if I hadn't been traveling around. So it affects people a lot differently. Now, fortunately, 90% of the people that get this can be treated at home and aren't going to be seriously ill.
Next, thank you, Dr. Mason. Next, we'll talk to Mayor Tim Kent.
Thank you, Dr. Evans. I'd like to just start off by saying thank you to our professional medical community, our doctors and our nurses. You know, they're on the front line of this stuff, and they keep doing what they've always done. But I want them to know how much I appreciate them. Our hospital is second to none. I know from looking at stats, but we got a lot to be proud of here in New Albany. But our doctors and nurses and our other hospital staff has done a yeoman's job on this thing. And I call them a lot just to get advice, and they always keep everything up to date. But I'd like to also thank our city workers, especially our guys that pick up garbage, our street department. Nobody thinks about them, but that's one of the most asked questions we get at City Hall. Are they going to pick up my garbage this week? And they haven't missed a beat, and they haven't complained. Now, we give them personal protection equipment, and they do put it on, but they still go out there daily and pick up what's necessary and what we got to do. I mean, can you imagine what not picking up garbage for a month? It'd be a disaster. But that's one of the questions we get at City Hall a lot is, or are they going to pick up my garbage? Now, trash is a little different. Trash is like limbs and that kind of thing, and boxes. They pick that up every other week during this time. but the garbage will be picked up daily. The question I get asked the most when people call and ask for me, can I drive through town? And the answer is yes. Nobody's gonna stop you if you driving through town to go to an essential business or to go to work. You're not gonna get harassed in any way for doing that. We don't have a curfew here. We get that question a lot. I'm starting to get a lot of questions about drive-up churches. As of now, we are allowing that as long as you have an area big enough and as long as you make sure that your parishioners don't get out of the cars and start mingling and talking when the service is over. As long as they leave as soon as the service is over, we have no problem with that. I think you can even, and I'm illiterate on technology, but I think you can even get a radio station that you can hear it within a block. So, you can tune into your radio and listen to a service. And we have no problem with that as long as people continue to follow the rules, which this community seems to have followed them tremendously so far. And the longer we follow them right now, the less we'll have to follow them in the future. I will say Toyota called me Friday and said they were planning on cranking back up May 4th. They didn't know if they'd have to extend that or not, but we're hoping, and they're hoping, that's a good target date. I get asked that a lot, how much longer will this last? And if I could answer that, I'd be over here in Dr. Mason's seat, but I have no idea. I mean, it depends on you. If you keep the social distancing and follow all the rules that the CDC's recommended and our medical community is telling you daily to follow, we will get over this sooner than later. And probably people ask about walking, especially on the trails or bike riding. We really encourage that, but we want you to stay 6 feet apart. You know, the trails are open, and as long as you stay 6 feet apart, nobody's going to ever stop you. But now, the police and others have got instructions. If you're gathered in a group, even walking, they will come and ask you to separate. So keep those things in mind. Like Mr. Evans says, we've never been faced with this before. And so some things we don't know to do or what to do. We just have to try what we think's best. But you can call City Hall anytime you got a question at 534-1010, and please do. Thank you.
So, Mr. Kent, one of the questions that was emailed in was about city facilities, when you think those might be opened up, the sportsplex, the tennis courts. Do you want to answer your ideas on that?
It would be a guess, total guess. Hopefully in May, maybe. That's what we're just wishing for. It may be even June, but we probably won't until the medical professionals tells us it's okay to have a group of people together. Or, you know, it's like, to me, it's like playing the odds. The less people you're around, the less chance you've got to get it. But until we feel like it's safe to be in a group of people, it will stay closed.
Yeah, and another question people asked was if they're out and the police stop them, are they going to get a ticket? Or are they just, like you said, they're going to be dispersed? But do we have any rules on, like, they're going to get fined?
Well, it's a possibility of a $500 fine and up to $1,000 if it's second offense. But that's if you ignore their first request. You know, the first time they're just going to say, look, y'all know you're not supposed to be any closer than 6 feet. And but now believe it or not, we will have some walk off from the police and go back together. So that's an entirely different problem. But if they just stay 6 feet apart to start with, it won't be a problem.
To reiterate what these two gentlemen have said, the bottom line is do what you're being asked to do. It's very, very simple. You know, even though I don't like it any more than these two gentlemen do or any more than anybody else in the city does, but rules are in place to protect you, not to cause you issues. And if you do not adhere to what these gentlemen, the medical community, and our city officials are asking you to do, you're just extending the time in which this is going to potentially have to take place. So if you do the right thing, you're never wrong. That's the bottom line. So just please do what they're asking you to do. And we're lucky, like Dr. Mason said, living in a smaller town, we are more spread out. So if you are gathering, you are doing it on purpose typically. So, and with no one in our law enforcement community wants to have to break up groups of people, but they'll have to do that and make their life easier, because there's no reason to do that now. I run on the trail the other day, and it's lots of people are on the trail, but everybody is. One that I encountered was observing the social distancing guidelines. So, in closing, I just want to thank our teachers. Want to thank all of our maintenance staff, all of our maintenance staff, and our cafeteria managers. They work they work every day, and our teachers are working every day. So while we have some employees that are non-essential employees that are not necessarily working every day, that's just how that works. But those people that are being called upon are here every day, and think about them. Think about the people that are involved in helping hand out the lunches and the breakfast and the lunches. Remember, those are on Mondays and Wednesdays. On Mondays, you get Monday and Tuesday's food, and on Wednesday, you get the rest of the week. Our local churches are providing the financial resources for the weekend meals. Over a course, understand that's about a $4,000 commitment per month. So people are stepping up. Parishioners are stepping up. People in our community are stepping up. So just do the right thing, and hopefully we'll shorten the term in which we're having to deal with the current issue we have. Thank you.
Dr. Mason, 2 questions for you. Is people are asking if they think they have it, do they still need to go to Tupelo for testing, or can they go to the hospital in New Albany for testing? And the second thing is, can they come for regular medical care? They just are having something that's not,
Okay.
End of the world thing. Can they still come in for that type of care? And then the last part is, when they come to the hospital, do they need to wear a mask or anything like that?
Okay. First part, if you think that you might have coronavirus, based on your symptoms, if you're having fever, if you're having flu-like symptoms, body aches, cough, the first thing we recommend is calling your primary care provider. If you don't have a primary care provider, you can look at baptistonline.org, and we have a number there that we can get you connected with a primary care physician. Currently, our hospital here in New Albany, we're not doing outpatient testing. There are several places in town, several local clinics that are doing outpatient testing. So that obviously, if you're sick enough that you think you need to go to the ER, you certainly do come to the ER. And if our ER physicians or ER providers think that you need to be tested, you will be tested.
So when they come, do they need to wear a mask or gloves or anything like that?
We have a protocol that anybody, the entrances to our hospital, we've kind of pared those down so that during the day we may only have 2 entrances to the hospital. Those entrances are being manned by people who are screening people who come in. Number one, they're checking your temperature, and then all people who come into the hospital are being given masks. They sure are.
And then if it's not an emergency, regular medical care?
Well, right now, one of the things that we're trying to do is we are trying to, part of our strategy is we're trying to be prepared should there be a surge. And part of that preparation is being able to preserve our PPE, our personal protective equipment. And so we are trying not to utilize those for non-essential visits. So if it's something that can wait, if it's just a routine yearly checkup, right now it's recommended that be postponed. Many of the clinics, and as a matter of fact, I'd probably say that most of the local clinics around here are providing some type of telemedicine visits. So I would recommend that you call your primary care provider and see if they are offering telemedicine visits. Most clinics are.
All right, so while you were talking, somebody asked, what about nursing homes? If I have a relative in a nursing home, would you recommend right now going to visit or staying away?
I would recommend staying away because obviously those patients in long-term care facilities, they are at much higher risk, and we want to do everything we can to protect them.
Does anybody else have anything you want to say before we wrap up?
I would just like to say, please consider supporting local businesses. They're all struggling right now, and they need your help more now than they probably ever have, because their business is cut in half or less. So please, and somebody recommended the other day maybe going and buying a gift card to use later. But anything you can do for our local businesses will help our city and help our community to survive. That's all.
Dr. Evans, can you also talk about just what hours the schools are open for phone calls if people have questions?
Yes, so all of our schools, just as they have been, are open from 9 to 1 for phone calls only. The offices are not open. If you were to go to the schools, you would not be allowed to be in the school. So just call the numbers to the individual schools, and you will have an administrator that will answer the phone and get you directed in the right, get you headed in the right direction to ensure that you get the information that you need. But again, do not come to the schools. There's absolutely no reason to come there because there's no one there. So that's just please be sure and use those phone numbers.
Mr. Kent, one of the things that, or Mayor Kent, that people were asking if you could relay the information from Ms. Dunham about the courthouse and coming in renewing tags and that kind of thing.
Yeah, they will allow you to call the office. And most occasions, they'll just come out to your vehicle and allow you to sign the proper paperwork. But the courthouse is locked. So, but they do have a curbside service, and they'll be glad to help you with that.
Thank you again, gentlemen. The only thing I could say is, again, what Mayor Kent said, support your local businesses. It is a very difficult time for them, so we want to make sure that they are still here when this is all said and done. But gentlemen, do y'all have anything else?
No, thank you.
Thank you, and thank you for tuning in.